So that's almost 33-year-old set of implants, silicone. And as you will see, complete and block 22124 initials AG. I cut out the excess skin that really helps. Relatively very large implants for her chest. And looking at this, the question is it ruptured or not? This is exactly how the implant was sitting. And by touching it, you can see some areas relatively thin. You can see right here some areas relatively thick. So I'm going to go in and we will see. She had the many symptoms of breast implant illness. She is a local patient. So as I go in, she has calcification up here, relatively very hard. Now this is your implant, all contained. This is your relatively very wide implant. Now I'm going to go ahead and let's look at this together. Look at all this. This is textured implants. It's not soft. And look at all this fluid that's around. So, so very intact implant, very much intact. And you have this. If I show you, look at this gel bleed. This is slowly leaching into the periphery. This is what we have seen constantly with saline implants, intact saline implants, intact silicone implants, as you will see. And there's a lot of like weeping over here. Look at all that tissue around. It's just like giving off all this toxicity, if you will. I invite my scientists who are listening to do research on this fluid because this will tell you what is slowly leaching out. And this is that fluid, despite what is an intact implant. Now, what I'm going to do is I'm going to go ahead and see. I see no information on the back that tells me the manufacturer. There's nothing. Usually there is an imprint or like a writing. And then let's see the capsule, complete and block. Some areas relatively thick, as you saw over here. Some areas thin. You can see, look at my glove. So if I put the ruler here, you can see, you can read out the numbers 8, 9. It doesn't take much to cut into. Now, luckily for her, she has an intact implant, but remember, even with the intact implant, don't want this to leak into the side, despite what is very thin. No matter how thin the capsule, it must be all removed. So this is very important. Now I'm going to go ahead and remove my top glove. In the meantime, I want to go ahead and focus on, this con procedure, how I do it. No lift. She's so inflamed. It was a very tough surgery, even though she was above the muscle. She's so inflamed that this is not the time to be doing a lift on a 67-year-old because this is set up for problems like dehiscence, infection. No need for drains. I have not put in drains in any of my patients with intact saline, ruptured saline, intact silicone, ruptured silicone, even in the last now well over 4 years. I give the patients the high definition pictures and videos so that they can see on the chest that everything was removed. That is very important. And also the videos of me cutting open the capsule so the patients see exactly how the surgery was done. I send the capsules off to pathology. Certainly in this case with textured implants and with the non-textured implants as well, because remember they're also implicated behind BILCL, which is very much underreported. So anytime any tissue is removed from the body must be sent to pathology. I take cultures for bacteria and fungus. Number 6, I return the implants to the patient. And number 7, deep sedation with basically, which is what is propofol, fentanyl, Versed. Patients are very comfortable and they don't need the full general. And all patients, regardless of their comorbidities, if they have type 1 diabetes or Crohn's or they're on steroids for whatever underlying problem like lupus, they get the same surgery. We don't compromise, I do not compromise the surgical removal of the capsule because of the patient's comorbidities. All patients, regardless of age, or other illnesses, they get the same surgery, which is the removal of the whole capsule implant plus all inflamed tissue and block, the gold standard. Now let's go ahead and open up the left side. I cut out the excess skin. That helps. Now let's go ahead and look at the back. Again, relatively some areas thin, thick, and these are implants that are 33 years old, and good for her that they are very much intact. So as I go in, same thing I see over here. These are intact, and good for her. These are intact up there so far. And you can see what is a formation of a secondary capsule here. And look at this, a lot of fluid around. If I go like these are my new gloves. I basically have a new pair. As you will see, look at this. This is your gel bleed. That's the small amount of fluid. This is not enough to be sent to pathology. Now, what's interesting is this. If I go like this, it says 300 over here. So there is a tag. There's a tag 300. It says. Now I will tell you. I'm going to change my gloves, and I'm going to go back into that. I'm going to send this off. So you see, look at all this fluid around, and again, a capsule that is very much thin, and very thin capsule. You can see my blue glove, and no matter what, how thin, the entire capsule tissue must be removed. Now you can go focus here till I get another pair of gloves, and then I want to look at the inside of the right one. I'm going to get a new pair. So what I'm looking for essentially is, these implants are essentially integrating. The 300 tag, I'm going to look for it real quick and see if I can find it. Uh, the entire implant capsule has been removed, so whatever badness, look how it's weeping. Literally, it's like crying. So if I go in over here, I've gone in, looked. I'm going to go right in the center with the same pair of scissors. Remember, this is hard. So this is the imprint right here. You can see the circular area. So essentially what I'm looking for is that tag that might be embedded in here. We'll see. If we know that if it did detach, oh, here we go, I think. Very thick capsule on this side. Nothing that I see here. But anyways, maybe it was never part of that. So complete removal of the entire implant capsule, all inflamed tissue, all contained. Good for her. Both of these are intact, textured. 300 on this side, and I'm going to assume 300. And she said 300, but she got her back in 1991. Nice lady, 67 years of age. So she got the surgery 10 years, 20 years from now, she does not have to worry about any residual capsules because anything inflamed tissue, even this tissue that you see right around, has been removed completely, definitively. So it's that there is no inflammatory burden left behind. And as you will see right here, this tissue is not healthy. And as I will use my pickup, I just want to dissect this open in case I find something. So nothing over here. All of this tissue is inflamed. This could have been a focal rupture. If I touch it, you can see it is relatively very hard, very thick. So all of the inflamed tissue has been removed, and no inflammatory burden is left behind. You can see, look at this small, it's very interesting. Let's have a look here. So look at this. This is a small pocket that was here as I cut open that basically was feeding into this. So as it was closed like this. So this is where you never know by palpation, visualization, any inflamed tissues removed, and all good, healthy, viable tissues left behind, and she will get the best chance to bounce back. We'll certainly hear from her and how she's only going to improve. And for the rest of her life, given the pathology workup plus the microbiology workup, she'll not have any quote surprises later on in life. As far as potential malignancy squamous cell, because the entire workup has been definitively done as we showed earlier. This is Dr. Khan, Executive Plastic Surgery.